I'm Fatuwaste Mitakiapi, or Good Day Relative in Lakota. I'd like to welcome everyone to today's event titled Reflections on Burnout and IPC at UIOs, a Storytelling Approach. I'm your host, Marie Zephyr, and I'm Oglala and Kowichasha Lakota, a doctoral student in Indigenous health, an artist, a mother, and a proud auntie. Today's event is the second in our NCUIH Project Firstline Community Learning Series titled Weaving Resilience into Infection Prevention and Control, or IPC, for UIOs. Next slide, please. Today's session will be recorded for educational and quality improvement purposes. We ask that you please turn on your video if you can, mute yourself when you're not speaking, and introduce yourself in the chat by providing your name, organization, and any tribal affiliation you may have. For today's session, after this overview, we'll move into opening words, knowledge sharing, a storytelling activity, and an open floor before closing the event. Our objectives for today include to reinforce key IPC concepts or actions, to use storytelling to reflect on burnout and IPC, and to highlight resources and strategies that are helpful. You'll also see a QR code on many of our slides, so please scan the QR and complete our survey, and also provide feedback on today's event. Our NCUIH team works very hard to make these events happen, so your feedback's much appreciated. Also, you'll have a chance to win a raffle of some really nice NCUIH gear. So please make sure and provide your feedback. Once again, we appreciate your input. Next slide, please. So to provide some background, the National Council of Urban Indian Health, or what we call NCUIH, is the national nonprofit organization that's devoted to supporting the development of quality, accessibility, as well as culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. NCUIH is the only national representative of the 41 Title V urban Indian organizations, or UIOs, under the IHS. Under the Indian Healthcare Improvement Act, NCUIH strives to improve the health of over 70% of the AM population that live in urban areas and supported by quality healthcare centers. Next slide, please. Today, we'd like to acknowledge that NCUIH is a proud partner with Project Firstline as supported through our cooperative agreement. The CDC is an agency within the Department of Health and Human Services, and the contents of this program do not necessarily represent the policies of the CDC or the Health and Human Services, and they should not be considered an endorsement by the federal government. Project Firstline is a national collaborative led by the CDC to provide infection control training and education to frontline workers. And NCUIH is one of more than 75 partners across the country who are working to provide innovative and accessible IPC education, as well as support UIOs in the best way possible. Next slide, please. Here's an overview of the NCUIH team. As you can see, we have some pretty awesome people on this team that work really collaboratively. In addition to myself, you'll also be hearing from Alyssa Longi and Kyle Mitchell during today's event. And today I wanted to take a second and really welcome everyone to this virtual circle with a short prayer of thanks and gratitude, as well as we share this learning space. And I'm going to say a short prayer in my language, the Lakota language, which starts out with Waka Tonka, Great Spirit, Great Mystery, Tunkashla, our grandfathers, and Makashkashka, the Spirit of all things. Wopila Tonka, many thanks for bringing us in the circle today. I ask that you wrap your arms of protection around the healthcare workers in this room, all of our families, the patients that we provide services for, as well as those vulnerable that need us in a good way. And I ask that you protect us all from harm and guide us in this important work that we do the best to help heal our nation. Tunkashla, help us to take care of ourselves so we could take care of others. Be safe while helping to protect our communities and our loved ones from harm. Help us to carry the good ways and intentions of our ancestors and lead us in changing the narratives of the cycles that that will take us back to our traditional ways of healing to Kashila. Wopla Tanka, many thanks again, Dakya Oyase, which means we are all related. Thank you all for your willingness and open-mindedness in hearing my prayer today. Now I'll go ahead and hand it off to Alyssa as we go on for our knowledge sharing.
Yeah, thank you so much, Marie, for sharing this prayer and just starting us off grounded and in a good space. And welcome, everyone. Thank you for taking the time to be here with us today. We know that everyone is really busy, so we really appreciate you joining in. My name is Alyssa Longi, and I will be leading us through the knowledge sharing portion of the presentation, where we'll be looking at burnout and risk recognition. I do want to take a brief moment before we get started just to prepare everyone that we will be talking about burnout, and we do acknowledge that some of us in the audience may be experiencing or have experienced this in the workplace, and we recognize how challenging that can be. So just to provide like a quick background on myself, I'm Sue Assiniboine from the Fort Peck Reservation in Montana. However, I was raised on the Yakima Indian Reservation, which is located in Washington State. I'm a public health manager at NCUIH, and I've been working on the NCUIH Project Firstline team for a year now. And prior to working to NCUIH, I worked as a registered nurse, primarily in the inpatient and ambulatory setting. All right, so as we dive into this discussion on burnout and infection control, I do invite you all to also just reflect on your own experiences, whether that be past or present in your UIOs or facilities. We will have an opportunity later on in the session to share our stories through the guidance of our wonderful storyteller, Kyle Mitchell. So yeah, just relax, sit back, and also reflect as I share all this information with you. And so we'll just get right into it. Burnout is a term that you may have been hearing more and more frequently in the healthcare context, especially following the peak of the COVID-19 pandemic. The US Surgeon General defines burnout as an occupational syndrome characterized by a high degree of emotional exhaustion and depersonalization, such as cynicism, and a low sense of personal accomplishment at work. And I do want to mention that while burnout is a topic discussed widely in healthcare settings, it can happen and occur in other workplace settings as well. However, for this presentation, we will be focusing on healthcare settings. And so what are some factors associated with burnout? Well, there are many different factors that can contribute to the risk in healthcare settings, including long work hours, the stress of infection exposures, and the intense emotional toll of caring for people who are sick. These factors can also come from different levels of society, and they can impact workers simultaneously. And you can see some of the examples here on the screen where you have, limited flexibility, structural racism, mental health stigmas in society, also excessive workload and work hours. And I do want to highlight that absence of focus on health worker well-being. As healthcare workers, we're taking care of others, but there is that focus that needs to also be on the healthcare worker well-being. So as I mentioned previously, burnout is not a new phenomenon. Even before the COVID-19 pandemic, burnout was taking a severe toll on our workforce. Specifically, up to 54% of nurses and physicians and up to 60% of medical students and residents were reporting burnout. And I just want to let those numbers really sink in, because those are our frontline workers, our nurses, our doctors. And they're taking care of our relatives, our elders, of us. And to see that many are reporting symptoms of burnout is quite alarming. The pandemic also exacerbated burnout, including building on existing disparities of burnout among health workers. One survey of nearly 21,000 healthcare workers in different roles in 2020 found that over 40% were suffering from work overload, and nearly half were experiencing symptoms of burnout. And for healthcare workers of color, stress scores and fear of exposure were the highest. And again, just letting those numbers really sink in. So what are some of the consequences of burnout? What can happen if it's not being addressed? Well, it can have a variety of effects on individual, interpersonal, organizational, and community health. For example, burnout can lead to increased risks of anxiety, depression, isolation, substance abuse, heart disease, and more among health workers. Burnout can also have consequences for patients and the healthcare system at large, such as health workforce shortages. So thinking of, staff turnover, short staffing. When you have short staffing and that turnover, that load often gets transferred and that burden gets transferred over to the staff that you have. And then there's delays in diagnosis, slower qualities of care, and increased risks of medical errors and hospital-acquired infections. You also have less time to spend with your patients and less capacity, and you don't have that time to sit there and listen and hear their stories. And all of this can add up to further impacts our community, such as increased health disparities. So why are we talking about this today? And what is that connection between, burnout and infection prevention and control training? We know that when you're experiencing burnout, you may not have the bandwidth to take on new information and more tasks. The COVID-19 pandemic really highlighted some of those gaps in infection control training among healthcare workers. Many were faced, with an overload of new trainings and policies and procedures and just constantly trying to keep up to meet those standards and information. And we do acknowledge that frontline workers may be experiencing training fatigue as a result of this. Project Firstline also recognizes this and recognizes that burnout and low bandwidth, and as a result has tailored bite-sized training content for on-the-go use and integration into your workday. And I really want to hone in on that integration in your workday, because it's not, adding another burden onto the healthcare worker when you already have so much going on. So really using tools that can just be used passively and naturally throughout the workday. And we'll be sharing some of those training tools. We'll also be discussing how to use risk recognition strategies to help staff with practicing those measures in their daily work. And then we'll just be taking a step back and also looking at the how and the why behind infection control in healthcare settings. So that brings us to risk recognition. Risk recognition. You're going to hear me say it many times, and it involves seeing the potential for problems to happen and taking action to prevent these problems. It really is a key part of infection prevention and control in healthcare settings, because as many of us know, there are many opportunities for germ spread and infection risk in these settings, whether that be from our patients, our colleagues, ourselves. Patients who come to healthcare settings are typically may be sick, and they may be vulnerable. So it's definitely an opportunity for germ spread. So to recognize risks of infection, we also need to understand where germs live and thrive, and these are referred to as reservoirs. You can see some examples of common reservoirs here. So you have body reservoirs such as skin, respiratory system. You also have environment reservoirs, so dry surfaces, devices. It's also important to consider what type of facility you work at. So whether it be outreach and referral or full ambulatory or behavioral health services, it's good to recognize and be familiar with which reservoirs you may be more likely to encounter depending on the different services that your facility provides. Germs also spread from reservoirs via pathways, such as through touch, breathing in. You also have splashes or sprays, or bypassing or breaking down the body's natural defenses. Being aware of where these germs live and how they spread can help us all to recognize infection risks in healthcare settings and beyond. And so how do we put this all together, the reservoir pathway, risk recognition? For any of you who've attended some of our Project Firstline trainings in the past, you've likely heard us talk about these concepts before. And I just wanted to share a really quick story as to why it's really important to have these solidified. And so I went to the clinic not so long ago, and I went up to the front desk and, I handed my ID and everything over, and there was like hand gel, masks, everything was good. And I thought, oh no, I'm gonna have to fill something out. I don't want to touch like the pen. And then I realized they had the whole, dirty pen, clean pen thing. So I thought, okay, they're disinfecting, so that's good. And then the person checking me in had pulled out a tablet, and I start thinking like, oh no, like, where's that tablet been? Was it in a patient room? I'm like, is this my nursing brain or is this Project Firstline? But I'm thinking about all the germs that are on that tablet. And then she actually disinfected it before she handed it to me. So I'm like, okay, they're on top of it. And all was good. I was checked in and she got ready to hand my ID back. And then I'm like, wait, I didn't disinfect my hands before I gave her the ID. I didn't clean the ID. Any germs that were on there now are on her hands. I don't know what germs she had. And now I'm all thinking like infection risk, like what am I going to do? And like, oh, I'll just do hand hygiene after and clean my ID. And like I said, I don't know if it's my nursing brain or if I've just been working on Project Firstline for the past year, but I feel like I was passively doing risk recognition without even realizing it. And it's just a reminder that the infection control actions at any one of these key points, whether reservoir or pathway, if you look at any of those key points, you can stop germs from spreading. And just being able to make the decisions. So it's important where the germs are, so which reservoir you're dealing with, and just knowing, how the germs might get somewhere else, so the pathway, And then you can recognize the risk for germ spread to happen and do something about it. And of course, I recognize that infection control it's more complicated than this, and it goes way beyond that, regarding different protocols and procedures. But when you're thinking about how this connects to burnout and training fatigue, when you have those concepts down, you're able to just do it in your workday. And it can happen at any level in the organization, whether you're in leadership or you work in admin. There are opportunities for germs to spread, and there are opportunities to recognize those risks and take action and play your part. I also think, we've talked about these technical terms, but it's good to take a step back and really think about why we do infection prevention and control. Yes, we want to stop germs from spreading. Yes, we want to protect ourselves, but it goes beyond that. It helps protect our colleagues, our patients, our communities, our relatives, our elders, and more. And this is something that I try to remind myself a lot, especially when I was at sort of a point in my nursing career where I was really tired. I always felt work overloaded. I thought, do I really need to scrub the hub for 5 seconds and dry it for this long? Do I really need to disinfect the surface and wait for it to dry? And then I really would take a step back and think, what if there's a germ on that surface? And what if it does make someone's elder, someone's relative sick? And so it was just important for me to always kind of take that step back and remember who infection control really protects. I also think it's a good moment to weave in the medicine wheel. Kyle will go a little bit more into this in his portion of the presentation, but just when I reflect, why did I go into healthcare? Why did I want to be a nurse? Or why does anyone really go into healthcare? Because we want to help others. We're trying to fill the buckets of others and help them achieve a balance in their life and their health, and whether that be mental, emotional, spiritual, or physical. We can sometimes forget along the way that we also need to maintain balance in our own life and filling our own buckets to avoid facing burnout. And this is something that I often found myself forgetting in my nursing career. I worked a lot with kids, I worked a lot with families, and it can be tiring and it's exhausting. And I would forget when I go home that I need to also take care of myself so that I can take care of others. And that's why I like to use the medicine wheel as a reminder of just how important it is to find balance in these areas. When you're balanced, you can stay motivated and adhering to infection control practices, but also just showing up to work and being able to perform at your best. So I talked a little bit about, balance and what we can do for ourselves to try to stay motivated, but what else can be done to maintain to address burnout, Well, we can try to build connections with colleagues and families and friends and just have support systems in place to turn to when we need help. We can take time to check in on mental health, of wellness of those around us, and also for ourselves. So staying balanced, making sure we're filling our buckets. And you might ask, well, what do I need to look out for? What are signs of burnout? If you're noticing symptoms of negative mood, emotions, low motivation and satisfaction, increased irritability and impatience with your colleagues or your patients, you may need to take action to reduce your risk of burnout. And we also know, this isn't just an individual burden to address burnout. Organizations also need to take action and make efforts as well. Organizations can work to improve access to affordable, destigmatized mental health resources for health workers. They can also take action to address cognitive burden for health workers and improve flexibility, foster that culture and value of workers and their well-being. And just in regard to infection prevention and control training, making sure your staff have the tools and feel supported and being able to perform their infection control practices. You may have all the PPE, which is good, but do your staff know how to use PPE? And if they don't know how to use it, do they have resources or know where to go look to use it? And there's tons of resources that you can find from the CDC, from Project Firstline, from other outlets online that show, the donning and doffing procedures. So just making sure that your staff are supported and using bite-sized digestible material, it can really help ease that burden of the influx of new materials and training fatigue. And so just to really, bring it all full circle as we kind of wind down from my part of the presentation, we talked about burnout. It's real. Our frontline workers are experiencing it. It's not easy to address, especially when it's structural changes. It can be experienced at all levels in the facility, whether leadership, admin. And it's just important to remember that what works for one person may not work for the other when you're trying to stay motivated and reduce burnout. And then just tying back to risk recognition strategies, that can be used at all levels as well to prevent the spread of germs. So whether you're admin or any part of the facility, you can use those strategies and play a role in reducing and preventing the risk of infection. If you'd like access to any additional resources on risk recognition or other infection prevention and control concepts, you can visit the CDC Project Firstline website. To be dropped in the chat for you. The CDC has developed a bunch of training toolkits. There's videos, interactive resources. You have print materials, job aids that are all ready to go. So I definitely recommend taking a look and seeing if any of them would be good to use in your trainings or share among your staff. We also have a list of resources here on burnout, and these will all be shared with you after the event as well via email. And from these resources, I do want to particularly highlight the 988 Suicide in Crisis Lifeline, where you can text or call 988 to speak immediately with the National Suicide Prevention Lifeline. I really want to thank you all for listening and being here and being open-minded to what I have to say. I recognize that burnout is difficult and it's hard to address, especially on the organizational level, because you may not always have, the tools or resources needed. But before we move on to open up the floor, I just want to leave some final thoughts. Working in healthcare isn't easy, especially when you're on the front line. And, we acknowledge everything that you are all doing. And just remember that, we are resilient, our patients are resilient, our communities are resilient. And when you work on the front line, you are in a unique opportunity to really make an impact. And that's something that I think we all want to remind ourselves when we are frontline workers. And so, we'll just pause now here and open up the floor for any comments or questions. You can come off mute, you can put them in the chat. If you don't have anything, don't worry, because we will be going into a storytelling part where you can share some of your thoughts. We will be turning off the recording, so if there's something you have that you don't want recorded, you will have an opportunity to share that as well. So we will just wait a minute, see if anyone has anything. All right. I'll just wrap up, and if anything pops in the chat, we'll look at it. But as we transition into the storytelling portion, I do invite you to be thinking about what keeps you motivated at work. This is a community of learning, and we would love to hear, what works well for you. Did someone come off mute? Nope. Okay. Well, we want to know, what works well for you. What are your organizations doing? And you can drop that stuff in the chat. You can share later. All right. Well, I think I'll pass it over to you, Kyle, and I'll watch the chat in case any questions come through.
All right. Thank you, Alyssa. Hello, everybody. My name is Kyle Mitchell, and I'm going to be leading us through a storytelling activity. If I could please have the recording muted now.
Resources. Interact with each UIO and more. The link to register will be shared in the chat as well. And I would also like to encourage you to visit our website, email our team, or listen to the podcast. There's some really good ones coming up. We also have more community learning events coming up later this year, and we hope that you attend. NCUIH also has additional events. And as you can see here, the link for these events page will be shared in the chat. Next slide, please. Lastly and finally, I would like to remind you again to please complete our survey and provide feedback on today's event. You can scan the QR code or use the link shared in the chat. Our survey response they really offered a opportunity for us to improve, and we'd like to be here of support. So you could also win some swag, win some NCUIH swag. So please feel free to fill this out, and we hope to see you at our next training event on May 11th. Have a good rest of your day, everybody.